I'm really interested in the community research partnerships. And I'm interested in it because I think the research questions come best from the communities as opposed to from the researchers. And that it's a fraught relationship between communities and researchers that often because of the power dynamics that exist in those relationships. And I'm very interested in how to balance those dynamics. And I see some of this time of changing priorities and people looking at their gigs differently as what are the opportunities in this time of kind of chaos. Big social changes often happen in times like this. In your guys' experience, and now that there's been so much transitioning in your experiences, what do you see as ideally you would like to see these relationships between communities and researchers? What is an ideal
Right.
state?
Yeah. So one of the things that I was thinking through while I was on my walk/run today and gearing up for this conversation and talking about equitable relationships, the power dynamic, this unique state that we're in, I feel like a lot of times we romanticize the past instead of learn
Mm,
from
mm.
the past. And I think that learning from the past is something that's really key. And when I think about an ideal state, I feel like we keep moving further and further from any kind of human solidarity and any kind of connection. And so when we're thinking about those equitable relationships, I think for me personally, it seems like it's been harder to cultivate those true kind of connections and that humanness. I will say from the learning and not romanticizing the past, one of the examples I was thinking of was specific to we at least know in the last 50 years or so, we've had an exponential growth in the amount of information out there. And that's a concrete something that we can point to. And I think that we, as a people, as a society, we have all of these points where we could potentially be connected. But as we've seen with a lot of research of late, that's not actually the case. Like we're actually becoming more disconnected and we're finding it harder in our communities, even knowing how to engage with programs like what Kirk is working on, or even in my position, like trying to identify the programs themselves that really want to do take that pause and make sure they're trying to um, be equitable, particularly on the funder side, and not have something that's just transactional or maybe not as generous as they thought if they're giving to programs, but there are strings attached. And I think all of those things happen because we stop seeing each other as human beings. We lose those touch points. And so when I think about an ideal state, I think it bringing those things back, but recognizing more clearly and more upfront the power dynamic that we bring and the different places in the ecosystem that we're operating. Because we can't expect those things to be the same and we can't expect to neutralize their impact, but we can talk about them more plainly and we can talk about them more consistently and acknowledge that they
Yes.
might have an effect. So I think as an ideal state, those are the kinds of things that are rolling around for me.
So, Kirk, it strikes me listening to Lacy talk in a way, the increased localization of this kind of work could lead to more relationship in the
Yeah.
dynamic. Whereas before, maybe things were too global. It was in the academic medical center, it was national, as opposed to that there's local interest. So, what are your thoughts about any of that?
Yeah, that's an excellent question. First, I want to make sure I acknowledge that Lacy's descriptions philosophically, from a values standpoint, I couldn't put it any better myself. Certainly, that's got to be at the core of this. Lacy and I know each other because we both served on the board of a professional evaluation society on the East Coast of the United States. And the practice of evaluation, evaluating policies and programs and use of resources and all the other things that we can look at with evidence. The root of that word is value, right? And by having the values that are driving whatever we're doing made explicit, we're much more likely to connect at levels in ways that are actually valuable. At human being level, not a technician level. But to your question, Danny, as a technician, a couple things leap out at me immediately in response to your question. One is that there was always, because I was primarily federally funded indirectly, there's always been a real drive for highly rigorous, high quality evaluation. And what that oftentimes gets interpreted to mean is evaluation research that's generalizable. And so that tends to drive us to quasi experimental kinds of studies that require lots and lots of participants, lots of people, require validated instrumentation, require quantitative data, and all of those things compromise our ability to really understand what's going on for the people, right? For the real live human stakeholders. So one thing that strikes me is that we could be, as funding gets picked up, I'm being optimistic here that funding will be picked up by other sources, but let's say the nonprofits get more involved in programs that in the past have been the purview of the feds. We're going to be freed of some of that, I hope, and be able to be more subjective, more mixed methods, more on the ground and kind of in the dirt, down and dirty out on the streets, learning what's going on for real humans, as opposed to saying, no, sorry, we can't even ask about whether this program works or how it works until we've got thousands and thousands of participants and we can do math about the outcomes. So that's one way I think that things might be changing.